Hi everybody, I'm Dr. Qazi. I'm a skin restoration specialist in Newport Beach, California. I focus mostly on acne and scars and pigmentation. I do a lot with collagen stimulation as well and facial balancing. I will go through this case and just talk a little bit about what I did today, which is really cool cases, really wonderful patients today. A lot of them come on the live as well. And I'll just go through just a slice of my life and how I do skin restoration over and over again for patients that have very complex scars and complex pigmentation issues and acne as well. We'll talk a little bit about what they go through and just the toll that it takes on their system and their mind, and how we've helped them in so many different ways. So this is a patient that I had. She's in her 20s, and you can see that we did a combination of essentially a few different things for her scars. She has a few issues. She had these little ice pick scars and Boxcar scars, and it's not as noticeable over here, but near the mouth area she also had a bit of rolling scars as well. And we had to do a few different things to break up that scar tissue with Subcision, and then also TCA Cross, and then we did some laser as well, and really worked on it as well with a little bit of volume replacement. And you can see it looks really awesome here at this point. Let's see, PETA is on here. PETA is asking, is Fraxel Laser good for atrophic scars? Not great. No, it was not great. It's okay, but I don't really find it to be too helpful for the vast majority of patients, and I think that there's a lot of better modalities out there. The patients a lot of times will say, well, I went to a dermatologist or so, or went to a med spa, and for my kind of scars, and they recommended 6 treatments of Fraxel Laser, and it didn't really help, or they did it combined with like PRP or microneedling, and it didn't really help enough. And it's something I went through. I did 6 sessions of Fraxel Laser. It's just like it didn't help. And the interesting thing is that it just hasn't changed much. Like all this stuff that we have and all the knowledge that we have, and people are still pushing the same kind of treatments over and over again. It's just not evolving. It's not changing. And it's, like I did my treatments 23 years ago or so, and it wasn't helpful for me. And so it's interesting, right? It's like a really interesting thing that it just hasn't changed. Let's see here. PETA's saying, my dermatologist suggested this over TCA. Well, it depends on what kind of scarring you have. I mean, maybe you don't have ice pick scars or Boxcar scars as much, or like particularly too deep. They're not too deep. Then maybe Fraxel was really superficial scarring. Maybe Fraxel will help a bit, but it's not going to help too much, honestly. Really not going to help that much. Let's see here. Faiza is saying, girls, take only iron and it'll go away. So Faiza believes that these scars are due to iron deficiency. So iron deficiency could cause a lot of different issues, a lot of different problems, and you're correct. Women are more prone to iron deficiency than men, but there's not going to be anything that's really going to be changing with these scars with taking iron. And there's some people that if you, potentially if you have normal iron levels and you're taking iron, you get iron overload. So you definitely want to check your iron levels before recommending something like that. And then again, it's not really going to be helping with these scars, Faiza. Let's see here. Kay is saying, I'm a student with all kinds of deep scars. What is a good low-cost laser or treatment I can do? It's tough to say, honestly. Unfortunately, it's expensive. It's unfortunately for deep, thick scars, like you said, it's going to be tough. It's going to be tough to find something that is cheap. But there's a lot of payment options. We do Cherry, which a lot of people are loving, and they have great terms. They spread out the payments, and it's just a little bit of money for every month or so, and we can spread that out for patients, and I think that ends up helping out a lot. Shiraz is saying, hi, Dr. Qazi. I hope you're doing well. I recently got used for an anti-pigment Thiamidol cream, serum, and SPF. It looks like, Shiraz, you got my recommendation for that. How effective is Thiamidol versus Hydroquinone for hyperpigmentation? So Thiamidol takes a little bit longer. For those who don't know, Thiamidol is actually, interestingly enough, it's a compound that was around for a little bit of time that was very similar to it, and they patented it. Eucerin patented it, and they ended up actually making it in a really nice composition with this pigmentation cream. And what's nice about it is that you don't get those side effects that you could get with hydroquinone, particularly if you're using long-term hydroquinone. You could get actually where the pigmentation can turn from brown to grayish pigmentation, and Thiamidol doesn't have that risk. So it's really helpful for that purpose. The question is that how effective is Thiamidol versus hydroquinone? There's not, as far as I know, head-to-head studies that evaluate it, but really from my own practice, I do it. It's pretty close. I wouldn't say it's necessarily better or if it's even the same, but it's pretty close. It's a lot slower a lot of times, but it's again safer and it could take a little bit longer. And overall, I find that patients tolerate it a little bit better because sometimes with hydroquinone, there's a bit more sensitivity with it. So I don't really get that as much. And some patients, actually like rosacea patients, for example, I found that they tolerated the Thiamidol, the Eucerin anti-pigment cream, more than they would with hydroquinone. Hydroquinone sometimes could exacerbate their rosacea. 2017, Mike is saying, hey, Dr. Qazi, I have a phenol peel coming up, but have some concerns. How should I reach out to you? Well, just talk to my team. We'll help you out. I mean, definitely want to make sure you're feeling fully comfortable with doing the phenol. I did two this week, and one of the patients, she comes on here quite a bit actually. So she's a really, really lovely patient, really, really amazing. I worked on her. She had done so many subcision sessions like over the last several years, so many different subcision sessions. I did a subcision on her last month. She already got significant improvement just from that subcision. That's all I did. And it was a really impressive improvement just from that. And now today we did phenol on her, and she's going to get an incredible improvement. So at some point, she lets us share all photos and everything. So at some point, I'll showcase her results. It takes a little while though. Diago saying, what's your go-to gold standard office treatment for post-inflammatory erythema? So Diago is asking for PIE or the red marks that occur afterwards, after sometimes procedures or acne. Personally, I really love lasers for that. Like something like XLV works very, very well. That's what I have. Other people have V-beam. I think the XLV is nice because it's got great contact cooling, so I could just go and target the vessels without causing excess trauma, excess damage to the rest of the tissue. So I use more XLV actually for myself. G. Santos is saying, does Pico help with acne indentations? It helps a little bit, just even regularly, just going slowly with it, it could help. There's ways of doing it where you could go a bit ablative with it, but it's pretty risky to do it that way. There's a lot of other options. It's probably not the best option there. Hi, Mrs. Jones. Good seeing you on. Mrs. Jones is saying beautiful result. I appreciate this. And again, this is a single combination session. I think that is really incredible and a significant improvement for this patient. She's incredibly happy with it. Very, very nice patient. And you can see that there's a softening of the edges of these scars. There's still a little bit of pigmentation that was still there. I think actually our pigmentation is better than it was before, but there's still some room to improve. So when she came in at this point, we did some TCA Cross and a little bit of Bellafill, and she'll just continue to get better and better results over time. Jules is saying, I thought Pico Laser was for pigment. That's a good, that's actually interesting that you say that. And it is helpful for pigment. It's definitely helpful for pigment. But, okay, here's the thing. There's actually a patient of mine that I was working on her nevus of odor treatment. And it was actually, what that is a birthmark. It was around the eyes, on her cheek area, the temple area. So interesting enough, this is actually an interesting story for you guys. I actually was working on it for about 8 months, like about once a month, and cleared up incredibly well. But what's amazing is that her skin quality, her under eyes, her cheek, her temple, like crow's feet, everything actually looks so much better on one side of the face compared to the other side of the face. There's just a lot more collagen production actually. And we were like, we gotta balance it out. That's what she was saying. She's like, I love this. The pigmentation's better, the skin quality is better, but I just really want to balance this now on the other side. So we ended up working on the other side then and getting it balanced. So there's absolutely a collagen response that occurs with the Pico Laser. And we focus so much on the pigmentation part of it, but there's like every one of my patients that does Pico, that works on it for pigmentation, they'll notice that their skin feels so much better. It's a lot more full. It's just like, it's pretty cool. It looks almost like a bit like filler, but it's actually just with the Pico Laser. Erica, it is awesome, right? It is really awesome. How do I Kitty's asking, how do I fix my acne scars? What kind of scars do you have, Kitty? Let's see. G. Santos is saying, does Sculptra work on acne indentations without subcision? So I had a patient, I talked about it just about 2 weeks or 3 weeks ago, who had gotten Sculptra done by somebody, and they were like, oh, when they were going in, they kept on saying and complaining about the fact that it was like there was so much fibrous tissue. So what they said was that they're going to just go around that fibrous area, and the Sculptra should just kind of still integrate with that area and still work there. That wasn't the case, actually. It ended up being that there was volume outside of the area that was pulled down and stuck. So you have to undermine the scar tissue. You got to go in there, actually break up that scar tissue. Don't break it up. You could end up actually where it just kind of goes around it. And yeah, Sculptra does dilute. It could spread a bit, but if there's like all this these fibrous bonds, it may not actually happen the way you expect. And certainly in this case, she was very dissatisfied with the fact that the way she had gotten Sculptra done, and she's gonna be awesome. It's gonna be a great result for her. Myra is asking, is this effective and safe for melanin-rich skin? Most of my patients have melanin. Most of my patients have a lot of melanin. We have Fitzpatrick IV and above for 90% of our patients. So we absolutely could do a lot of different treatments for that. And there's really no case that I always say that there's ways that we really should just be focused on things and specialize in certain areas. And I do find that there's no case that I haven't been able to improve over time. Really, it's just like over time, there's ways of solving this. And it's not necessarily that we have to do lasers and energy devices. It could be other modalities that we use, but it's just with a patience game and just working on things with in different layers in different ways, we could solve it. So if you are somebody who's potentially like Fitzpatrick VI of African descent, Aboriginal descent or so, then potentially, we don't necessarily have to use lasers and energy devices. We could use like Subcision like we did for this patient, TCA Cross like we did for this patient. We could do volume replacement like we did for this patient. And you could still get an excellent result. It may not be like as much of an improvement with the texture portion of things, but the atrophic scarring can improve quite a bit with that. So, absolutely, we could do it in all skin types, actually. G. Santos is asking, so will fractional CO2 help a little with the Sculptra for acne indentations without subcision? Again, I would say that it's tough to say without subcision. It's tough to say because I know so often that there's areas that's really stuck and thick, and you may need it. You may need it. Jay is on and saying, I went to Dr. Qazi because he works with people of color. Appreciate you, Jay. Thank you so much for coming on tonight. And hopefully at some point you let us share your results. That'd be really, really nice. But thank you so much. Andrea is saying, how do you know if there are fibrous bands? That's a really good question. Basically there's a few things that sort of people could look at. Take a photo just of yourself, just like straight on, if you have scarring, and you'll be able to determine that if you have a neutral expression, you may be able to see that there's a bit of an indentation that's really visible. A lot of times you will see that that's like fat loss, but if you then say, okay, well, there's quite a bit of that indentation, chances are there's going to be some fibrous tissue underneath there, and you have the patient smile, you'll see that it really bends around the scar. But the truth of the matter is that pretty much all scars really do have some fibrous bonds. It's just that sometimes if they're collected in certain areas and they have caused actual fat destruction, that there's going to be quite a bit of that those fibrous bonds that really do require more subcision than at that point. So we absolutely will want to go and actually manually break up that scar tissue, which works out really, really well. This actually the last few weeks, I had so many rolling scars and so many like deep boxcar scars, and I did a lot of subcision. I was doing so much subcision for this, and it worked out really well for patients. Let's see here. Hey, Dr. Qazi, how old do you have to be to come in? Well, it's really just, I could treat any adult as long as they're aware of just, any adult, anybody who's mentally competent that understands what's involved with these procedures, we could be able to manage for the scar portion of things. And it does have to be an adult because I do need to make sure that patients understand this is still an elective cosmetic procedure, although I agree that it affects people mentally, as we talk about many, many times. But it still has to be an adult, though, so really a fully formed opinion. Now, what that means, I'm not like a gung-ho about like the 18-year-old type of thing. Sometimes I find that like 21, 22 is like a better age for people to really understand what is happening and understand that this is, the procedures that we're going to be doing and this is how we're going to improve your skin. And I think a lot of science backs it up too, that really the frontal lobe doesn't get developed really for men, especially until you're 22. Someone could double check for me what the age is for frontal lobe development in women. Actually, I think it's a little bit less, actually, interestingly enough. But I know myself as a guy that I was very different at 18 compared to when I was at 21. And there's no question that there's an aspect really where that 18 number is kind of arbitrary. But there's a lot more development over those next few years, and I just want to make sure people really understand that this is what it takes. But I certainly also don't want people to suffer and go through scarring, and if we talk about it and evaluate it and it makes sense, then yeah, we'll take a look and see about doing it at 18 or so. But I just want people to be comfortable and confident in the procedure, understand it really, really well, and know what's involved with this process. That's why I do this all the time. Masood, I showed your results yesterday, by the way. Everyone was loving it. Let's see here. But I got to see you at some point again. Yes, Masood, good seeing you on too. I got to show your new updated ones. People are asking for the new updated ones. So hopefully at some point we'll see you again. We only showed the first session there because we don't, you're so far away. So at some point, hopefully one day. Ariba saying, I wanted him to answer, but I think he missed it. What was the question that you asked? How many Pico Laser treatments do you have to get done to see skin improvement for fine lines? That's really variable. It's really tough. I mean, you may not get enough improvement with fine lines and wrinkles, and so it's tough. I'm not sure if that's necessarily going to be the case. And it's really a process that takes a long time, at least 6 months, a year for collagen production. So it takes a lot longer than you may expect. And it could take really one session a month or so to get there. So it's a slower process because there's not much downtime. Safa is asking, what are your thoughts on Fraxel Dual Laser for South Asian skin? My skin pigments so easily. Yeah, it's a good question. I'm not sure if you necessarily need it for that. I don't know. It's possible that you do, but it's not even the best laser energy device for acne or scars. And in anyone, and now in a South Indian patient or South Asian patient, it's questionable. Would you really want to do that unless it has to be really justified and make a lot of sense? I don't know if it really does. Nadir is asking, hi, Dr. Qazi, do you also treat sun damage when seborrheic dermatitis is present? Yes, yeah, we could do that, absolutely. There's ways of controlling seborrheic dermatitis, and there's ways of just making it so that we could avoid hyperpigmentation in the future without triggering that, so we absolutely could help you with that. Frontal lobe develops into mid-20s. Yes, it does. I was actually asking, though, if you could look into it, because I don't want to type a bunch of stuff right now, but see when women, when their frontal lobe develops, it's actually younger than men, as far as I remember learning about. So if someone wants to look at that, see one is the age for women and one is it for men. And try not to get an AI generated answer, although everything is nowadays, I guess, but try to see what's actually there. So Masood is saying, yes, thank you so much, doctor. I will see you in a few weeks, God willing. Appreciate you, Masood. Thank you so much. Dr. Dimensel is asking, do you do training for doctors? I do. It's just I'm so busy, and there's a lot involved, and it can slow me down a bit there some days, so I have to really carve out the space for it. So just send a message, and we'll try eventually to circle back, but I am open to training. I want more people to get access to this information, and wherever we are in the world, people could just know how to do this. And I actually appreciate the fact that people want to learn this at a very high level. I really do. And so at some point, I'll go through more and more trainings for people when I get some time. But I have a lot of things I want to finish up right now that there's a lot on my plate just to make sure that we could do this very, very well over and over again. So Artie is saying that frontal lobe develops at 21 for women and 25 to 26 for men. Isn't that interesting? 25 to 26. Artie did a great job just doing some research over there. And he's saying at 21, your frontal lobe develops for women and 25 to 26 for men. That's really interesting, actually, isn't it? Isn't it kind of sad in a way how we've pressured society to believe that everything just changes as soon as you magically hit 18. And it's people are still kids, actually. So it's really kind of unfortunate also how these guys are preying on old young women, and they're in their older ages, sometimes it's middle age. They're well, it's legal. Well, maybe it's legal, but it's still really unethical and really questionable, the fact that they're going at these people that their frontal lobe hasn't even developed. Really questionable stuff, actually. But they're just oh, it's 18. It's now it's magically just done. It's a totally arbitrary number when you actually look at it. Let's see here. Ariba is saying, I am 22 and I don't want to get any procedures done to my face. I do get facials once a month. That's awesome. Yeah. So, you understand that you don't want to do those kind of procedures. That's fine. It's perfectly fine. Maybe do something like tretinoin too, and just try to see if that's going to help with your scars with it there. But there's likely, with scarring, there may be more things that you may have to do, and when you're more comfortable with it, I still am around, and we'll see what we could do for you if you're open to that. Andrea is saying, can you still get Sculptra under scars if the scars are in expression lines like smile lines? That's a really good question, Andrea. I actually do not like it in that area. I don't like in areas where you move, or animate your body. There's a way of doing it if it's very, very dilute. You could do some Sculptra there, but Bellafill works very, very well in that area, like incredibly well. So consider Bellafill instead. Let's see here. I missed a few questions here. Where was I at now? I kind of lost my place. So if I missed your question, sorry about that. Try to re-ask that then. And thank you so much, Mrs. Jones. Trixie's saying, hi, Dr. Qazi. Not sure if you got to my question, but how far out is your schedule and how much for the consultation for out of state? Just schedule at drqazi.com. Just go directly on our page, drqazi.com. Our prices are on there as well. And you could be able just to game plan from there, and my team will then just reach out to you for scheduling. We can do the consultations a little bit sooner, but the actual procedures will be pushed out because we are booked out, I believe, until September or so. But other people that have been are my patients right here may know a little bit better. And then fall time is pretty busy. So, I am putting a lot of preference on our current patients, like a patient like this, for example, because I want to make sure that they get their journey finished. And we are we are certainly seeing new patients still, but I want to make sure that all the patients that I have completed their journey and making sure that they are really comfortable and confident and happy with their skin. And they've got a different pathway in life. That's what I'm trying to get to. And it's like over and over again. Today, actually, I had so many follow-ups. Actually, it was a really interesting day. A lot of follow-ups today. I had a really cool Phenol peel patient today. Really, really wonderful lady. Really, really wonderful. And it's like I want to make sure that they just get done with everything and just get the best possible results. So at some point, I talked about it even last year that I'm going to be kind of not doing as much of the newer patients, and that's kind of coming across now, where I'm trying to put the priority towards our patients like this, who I just need to make sure that I can finish up their journey there in a manner where they don't have to suffer from scars for that much longer. That's what I want to do. Blossom every day saying, hi, doctor. What's the time frame for both pictures? This is actually 3 months out. I guess that got cut off a bit there, but this is 3 months out actually afterwards. So thank you, Mitra. Mitra saying you're the best doctor. I appreciate you guys so much. Let's see. Are acne scars on apples of cheeks hard to remove? That's a really, really good point. User 44 is asking a great question here. Are acne scars on the apples of the cheek harder to remove? In fact, they are, because it's an area where we're putting a lot of tension. We're smiling, smiling, smiling. It's stretching the skin. It's pulling on the skin. It's causing more tension. So as the scar is healing, it could actually make it so that you don't develop as much collagen production. Sometimes also what ends up happening is in that particular area of the face, it's like the T-zone. Sometimes there's more oil production. Sometimes due to rosacea too, it could flare up a bit there, and there's a lot more inflammation in that area. And it can make it so that you don't get as much of a collagen response, but you ultimately still could get that improvement. It just takes a lot longer. So lateral side cheeks, a lot faster, a lot easier for us to improve compared to the mid cheek area. That's absolutely correct. You're 100% correct about that. Oh, hi, Resin. How's it going? Resin's asking what we did for this patient. Actually, very similar treatment to yourself. This was actually a patient that we did Subcision, CO2 laser, TCA Cross, and we did some Bellafill for her. So a few different steps here under a single session for her, which worked out incredibly well for her after 3 months. And a resin, for this patient, about 6 weeks out, it was still red, pigmented, and it ended up clearing out a lot, really, really well. Ardid is asking, do you work with Smoothbeam laser at your office? I don't have Smoothbeam. What would be the reason why you were interested in Smoothbeam? Let's see here. Lino Sanchez is saying, with enough treatments, can it look like someone never had scars? It depends on the kind of scars where we're starting. I would say someone like this kind of scarring, over the course of 1.5 years, it's going to change some more. 2 years, it's going to be even better. And it will look pretty close to, really, unless you're using like a flashlight underneath there, really minimal scarring. Any negative impact on caffeine on skin? Not that I'm aware of. I mean, caffeine's a vasodilator. It's actually kind of nice because I actually myself don't drink caffeine, but I like the fact that it does help with blood flow. And one of the big things of this is blood flow. When we're healing scars, we want a good amount of blood flow to the area. We want that to really there's microvascular circulation to improve. So caffeine can help with that. The problem is that if you look at the way people drink coffee, for example, very few people, at least in California and also in Chicago where I was at, very few people just eat a straight black. I don't know if anybody on here eats a straight black, but very few people do. And usually they're putting a ton of milk in there. They're putting a lot of sugar in there. And that's where I think you can run into a lot of problems. I think you can run a lot of problems because of how much dairy that's in there, how much sugar it's in there. Nafisa is asking for aggressive treatment plans for patients who could take extra downtime. How long is it usually? So, for example, the 2 patients that we did Phenol peels on, we also do dermabrasion with those patients. Those patients are going to have about 12 days of recovery. So that's about what I would say for more aggressive treatments. And Daisy's saying that I told Daisy apparently there will be 10 days of recovery. And so I have a good gauge kind of like where it should go because I've done a lot of treatments and I can see like just overall, just typically how it should normally go. Usually most patients are about 4 to 7 days. Daisy, apparently I said 10 days. It probably was just more complex. A little bit more redness is going to be expected. And then for Phenol peels, expect really about 12 days. And there's still going to be some redness afterwards. Do you do consultations in Chicago? I mean, in a way I do because we do virtual consultations all the time. And hello from Chicago. I'm from Chicago too. Total's asking, hey, Dr. Qazi, there's no way to get to you yet, but what if someone who is at a lower level than you makes subcision with filler? Will it at least some effect? And what should I do after subcision and atrophic scars? I appreciate you. Yeah, Total, there's people out there that could do subcision and just be careful. Just like pay attention to how they do it and ask questions. I would say if they're like early on and relatively inexperienced, try to have it so that it's more like a blunt cannula subcision and more like the upper part of the face. But there's things that could definitely go wrong with subcision, and there's things that actually could lead to more scarring with subcision, even with blunt cannula that I've seen. There's like, of course, there's people out there that could do it. It's just rare, to be honest with you. So I mean, it shouldn't be. I'll put it this way. There's not going to be that much of a price variation as you may think. It's sort of like when people think, oh, okay, I'm going to go to Turkey, for example, to get rhinoplasty. But actually the guys that are very, very good and elite at rhinoplasty in Turkey, they still charge quite a bit of money actually. It's actually not that much of a variation from people in Europe or the US. It's not that much of a variation. So it's just kind of something to pay attention to. The prices, if it is really significantly lower, and our prices on our website, we're very open about these things. Subcision is just one thing that I just didn't want people to check out with, but I could tell you it's basically almost everybody's $800 to about $1,200. Some people, if it's more complex, could be more. But let's say most patients $800 to $1,200, and I don't know how many people are going to be doing that a lot cheaper. And if they are, they're likely saying, well, what we have to do is we have to do 6 sessions, 7 sessions. Like the patient I worked on, a Phenol peel today, she had done 7 sessions of subcision before in the past. A single session with me completely broke up the scar tissue, and she was disturbed by the fact that she had to do so many sessions and nothing solved the scars quite like that. And she already has significant improvement. So you're doing 7 sessions of an invasive procedure, there could be things that could go wrong with that. So if they were going too cheap with subcision and they're going to try to kind of say, well, we have to do multiple sessions, I'm doing this under a single session to get the best possible result. So just pay attention to those things. There are definitely times that people will try to make it seem as if this is something that anyone could do. But it's like anything that there is certain skill set that if you just do it over and over and over again, you could do it at an extremely high level then. But if you're doing it once a year or so, or twice a year, whatever the number is, and you're expecting people to come back and forth to do this may not be the best procedure for you. There's a way to feel it. There's a way to make sure you're checking to see how each band that you're breaking is broken up completely. There's a way to do it very safely. So, pay attention to those kind of things. Resin, you're right. It is crazy. It is crazy. There's a lot of people. Actually, that patient, I'm sure she's recovering right now, the one I did Phenol on today, but she comes on here actually. She says it all the time that she got so many sessions and the Subcision I did for her just broke up so well. Oh, hey, I'm up is on. What's up, doctor? Would it be fine to add benzoyl peroxide into my routine again for acne prevention? I usually don't do benzoyl peroxide after your scar treatments. I'm up. So let's talk, but I actually would prefer probably more like a sulfur-based, either sulfur-based wash or likely like something like Dapsone. That's typically what I end up doing. Blossom every day is saying, Dr. Qazi, do you offer scar removal service from cosmetic surgery? The scars are kind of thick. What treatment would you suggest? Yeah, I just did one yesterday actually for a patient with very thick keloid and hypertrophic scars from a tummy tuck. And I do steroid injections, do laser to help reduce that. Sometimes you combine the steroid with something called 5-FU to actually help with the inflammation too. And then you do silicone tape there afterwards, and that should hopefully keep it flat then for patients. So yes, absolutely we do it for raised thick scars there. Lefluent is saying, sorry, I missed the answer. When someone asks, is it possible to get results as if acne scars were never there? I would say that it's sort of possible in certain cases, depending on how thick the scars are. It's something that we just have to think about, though, that what are you really trying to achieve and hope for? I'm not shooting for, like, if somebody's shining a flashlight underneath your face, that the scars are going to be invisible. It's like I'm just not going to shoot for that. What I am shooting for is to make you feel really, really good about your skin and about your face, make you feel much more comfortable and confident about what you look like, and really, really, really want you to forget about the trauma of acne. That's actually what my goal is and my purpose is. It's not to get to 100%. I'm not shooting for 100% because I just don't know if that's an achievable result at this point. Some people, we could get there, and it's like there's a lot that's involved that, there's a lot of different variables like ethnicity, genetics, all different variables that can factor into your water intake. If you vaped, if you smoke, a cigarette smoked, if you drink alcohol, if you're overweight. So a lot of different factors, but there are people that I've showcased even on here who get pretty close to perfect. It is pretty close to perfect. And it's shocking to me and shocking to them. And it's shocking because I don't know, because sometimes it's so deep and so thick that I'm shocked that we got to pretty close to perfect in that case. But, certainly if we shine flashlights underneath there, will there be still some texture? Yeah. Actually, I was in the OR today and they had such terrible lighting in the washroom. And I was looking at it and I was like, gosh, there is some texture right now on my face. Like I had a mask on. There was like a little bit it just seemed like there's a little bit more texture there. And I was looking at it like, oh, there's a little bit of texture right there. And then I just have to remind myself that this is just like this harsh, really harsh, terrible lighting that's occurring in the washroom right there. And this is not real life. This is not like how it is day to day. And it's okay. Like it's fine. And I know how to solve it and improve it a little bit more if I want to. And I'll certainly keep doing that. But I just have to kind of remind myself about that sometimes. And if anybody's sitting there with a flashlight under your face, it's like that's a real concern that they are being like that to you. That's a really, really problematic. There's a real problem with a lot of people out there in the world who just comment unnecessarily to other people. There's a lot of people that just make unnecessary comments and statements like, oh, what are you doing for your scars, in a way that's derogatory to people. And it's harmful for them. It's harmful to their self-esteem. And a lot of people will find that they don't necessarily even have to say something. They just maybe looking at it or staring at it and just they just don't feel the best about that. And I want that to be solved for people. I want them to feel like it just looks a lot better for themselves. They feel comfortable talking to their clients or talking to, their family members or friends or their dates. They just feel much better as they're across the table from them. That is really, really achievable in almost everybody. That's pretty cool, right? That's a pretty cool thing to be able to have. I could feel pretty comfortable having that, where even very severe thick scars, we could get to a point where someone across from you is not really noticing your scars. It's hardly visible to them. And unless they're pretty much psychotic and losing a flashlight underneath your face, it's not too visible. Now that's awesome. Barely visible, make you really comfortable, confident. That is awesome. And I truly, I think everybody who's my patient, there's a lot of patients on here, and that are on right now tonight, I think they all know that I really will do everything in my power to get to that level. Like whatever we need to do to safely get to that point, we're going to get to that point. And actually, interestingly enough, it's like there are a lot of people that I end up showing on here who say that to me. They say, just can you get to that? Like, just assume that I really suffered a lot. Like, they told me, actually, today's patients are really telling me, like, I suffered a lot. I just really want you to do whatever you could do over time to get that kind of improvement for me. And I'll do it. I will do it. I will get to that level, and we will work on it and keep chipping away at it. And even if there's like a setback for a period of time or so, it's like manageable. There's every single one of these problems that occurs with acne or scars. If you have a breakout afterwards, things like that, these are all solvable problems. Like, don't feel like this is hopeless. There is a lot of hope out there in the world. And you saw, actually, there were some doctors out here right now. So even if you think, okay, well, you can't afford me, although we do have a lot of payment plans, but even if you think you can't afford me, there's people now that are going to learn, there's going to train. I have a lot of videos that showcase how I do this. I do it on purpose. I really strongly believe that things should be more open source, that science, I hate the fact that things are in paywalls, and like patients and people are just interested in this world can't just go look at studies properly because it's behind a paywall. Even if you have like an understanding of how studies work and you can want to interpret the study well, it's like you have to pay sometimes hundreds of dollars to access a journal article. It's crazy to me. And I want this to be this like more open. I want people to really expand knowledge the way, I grew up in a generation of things that were just like open, really. It was like, here's how, like, somebody was ripping, a DVD for us and ripping everything else for us. And they were making it so that this is all open and available for everybody. And it's like, that's really cool. And the guy that invented Linus, he set this whole thing up for free. He just built up a whole system for free for everybody to use. And like, how cool is that? I'm not saying that people have to work for free or things like that, but I mean that like he just enjoyed the process, enjoyed what was going on, and wanted people just to continue to improve it. And there's a lot of people that just continue to improve it for like free because it's fun and it's cool to do. And like, isn't that really cool? Like, wouldn't it be really cool if we just reset the game right here? Because we're so far behind in science. I don't know if you guys understand how far behind we are in medicine and science. We're so far behind. It's like shocking how far we are. We're so far behind. Like I just said, I was doing these scar treatments on my own face probably 23 years ago. And it's the same nonsense, garbage treatments that are still recommended today. The same nonsense, 6 sessions of microneedling with Fraxel Laser, and you got to do like this and that and get all these creams and do this. It's the same story for the last 23 years, at least. More than that. Obviously, it's been more than that. And it's crazy, right? Like, it's like we're so far behind because we're in this capitalistic garbage system, which is just insisting that people actually just have to be just completely money obsessed. Even if you have a lot of money, you just have to keep on demanding and expecting more money. And it's like nobody wants to advance anything. It's just like we're just stagnant. We're just sitting there stagnant for the last 24 years in the acne scar world, at least since I've tried to solve my own acne and my own scars. It's like been the same. And then you look at the 90s, it was like, when I was trying to solve my acne, it was hardly any different than what's going on right now. And so like at some point, like things just have to just get pushed further out. Like, and this was just like, whatever corner of the world you're in, I'm in this kind of corner, whatever corner of the world, look at the problem, look at all the people that suffer from that issue, and like, see, is there a solution to this particular problem? And it turns out that there actually is a solution for problem that people were making it seem as if there shouldn't be a problem. Hey, there's no problem. I hardly see your scars. I hardly see your pigmentation. My patient today, she flies in all the way from Philadelphia to work on her pigmentation. She's of African skin tone, Jamaican origin, and she has hyperpigmentation all over her legs. She says over and over that people tell her that there's nothing, you don't see it, there's nothing to be concerned with. There is definitely pigmentation there that concerns her, and she has to think twice when she puts on shorts or a skirt, and she just doesn't want to feel that way. She gets concerned when she puts on a bathing suit. And it's not even just about necessarily that she's worried about other people thinking something about her legs. She herself just doesn't love the way it looked. And now it's looking a lot better. Now it's looking a lot more evened out for her. And it's not necessarily that like, oh, we're so obsessed and so worried about what other people think about us. It's not the case though. Actually, it could just be that you look at it and you think to yourself that I don't like the fact that there is this issue right here, this damage right there. I wish that there was a better solution for that. And that's all it is. And that's actually like exactly the kind of thing I want to solve. I actually want it so that other people out there are carved out of your life who are bringing you down because of your acne, your scars, your pigmentation, or any other issue, and you just do it for yourself and do it because you just want to be like just the best possible version of yourself, and you just have this dream of yourself without these issues, and you want to look at your things, at your face, and look at your body, and you just want to feel comfortable and happy with what you're looking at, and that's all it is. And if there is somebody who does happen to make comments, whether that's your husband or if that's like your boyfriend or your girlfriend or wherever else, your friends, and they are making comments, and it's like, it is really time to carve some of these people out of your life. And I know people are listening to this, they are married and they're listening to things, but like, you know, really just evaluate it, like double check that and think about that and see that maybe it's like really important to at least have a really proper discussion with this person who is supposedly supposed to be supporting you, and maybe they're unaware of the way that they're coming across is not very supportive and it's actually bringing you down. But like if they're just continuously doing it, it's probably time to you know, push this aside here and get it so that you just focus on your own self. If this is something that does actually bother you yourself and it feel like it's holding you back, there's a way to get this at a really, really beautiful result ultimately. There's a way to do it, and it just takes a lot longer time than you may think, but there's a way to do it, and it's really cool. It's a really, really wonderful spot to do. Sierra Parker is saying, I put azelaic acid as spot treatment. It burned my skin and left a big black mark. Been 4 months. It isn't fading. What should I do? So you may need, we were talking about earlier, Eucerin's anti-pigment cream works well. Hydroquinone works well. Or you could do a laser. If those are not helping out, you could try to consider those. So those are all good potential options there. I appreciate you, Resin. I appreciate all of you guys on here tonight. I'm going to just try to hit like 1 or 2 more questions, but I want to finish up right now. So let me see, what's a question that we really, really need to answer here? Let's see, where am I at? Well, here's someone that was asking a few times here. If I got the trio with Dr. Ulam with Subcision, Phenol Cross, and erbium laser, but I still have really bad scarring, would you recommend just getting Bellafill every 6 to 12 months? Let's talk. You know, it's possible you need to do Subcision, you know, with me. And so let's talk. And so let's see what's going on. And go through my page at drqazi.com and see what needs to be done at that point there. Do you treat patients with active acne or only scars on clear skin? For scars, I want it so that the oil production is under control, and I want the acne better controlled. So oil is a really, really big factor for me. So I want oil. It's one of the biggest things I want controlled. And we can control it with either like Accutane or the Cure Laser. The Cure Laser just shrinks the oil gland just like Accutane, but it only works on the face. All right, guys, thank you so, so much. I appreciate everybody for tonight. Really great interaction, actually, although they still are shadow banning me a bit, though. So if you guys could share it again or so and just give me a follow, that'll help.